So
Go.
yeah, compounding pharmacy can get very nuanced. There are levels of accreditation. And so the most typical highest stringent level is a sterile compounding pharmacy,
Okay.
meaning you can make injectables like testosterone or peptide therapies. And those are held to a very high standard. And so one of the misnomers is if it comes with the approval of the FDA, it is safe.
Oh, I thought that was
And
the case.
and
It's
so
not true?
where this gets to be unbelievably challenging without going down a whole diatribe is if we're talking about medical equipment, 92% of the medical equipment put in your body, utilized on you in the operating room has never had a clinical trial, never had a human trial at all. It's all made it through a process called the 510K approval process, which is a loophole that the FDA gave med device manufacturers in the 70s. And the idea was that less than 8% of products that would go into our system would make it through this process. It flipped. Now 90+% is making it in through the 510K approval process. Here's why that's important. It's like comparing a Samsung flip phone to the newest iPhone. And you're still getting new products into the OR based off the Samsung flip phone technology. Does that make sense?
Oh,
And
God,
so,
yeah.
like hips, knees, you go from a metal on plastic to a plastic on plastic to a metal on metal. All that evolution never went through human safety trials. So as soon as they launched into the marketplace a metal on metal hip
Prosthetic
and
hip.
thousands of people put those hips in, they begin to shard off metal and create metal poisoning in patients, giving them dementia. There's hundreds of OB-GYN products that have been recalled. Less than 2% of adverse events are reported. And this is that sector. So now let's go to the pharmaceutical sector.
I'm sorry.
Yeah.
Never mind. Keep going.
Yeah.
I'll come back to
So
it.
then,
I'll come back to it.
but the point of this is to just make people aware, question everything. Don't think just because something is FDA approved that it is necessarily safe. Because let's talk about prescription drugs. Eli Lilly has a shortage right now for its GLP-1s and an array of different products. Why? Because multiple of its facilities have been shut down by the FDA for violations. Then what's happened is a large percentage of the big pharmaceutical companies have begun to outsource their manufacturing overseas to India and China. Why? Because if the FDA wants to inspect it, they have to give 3 months notice. They can't just show up. You're going into a foreign country. You have to negotiate with that country, come in, and then hope that 3 months later, by the time you get in there, that they haven't burned all the records or hidden it, which is what they've done. There's a whole book called Bottle of Lies that breaks down an investigative journalist, all of these facilities. There are literally, I think, over 2,000 major pharmaceutical manufacturing facilities that have
Sick
not
to my
been
stomach.
investigated by the FDA in over 5 years. 5 years. The FDA has been in my building 3 times in 18 months. I mean, it's nonstop because, and I'm not saying it's because they're attacking compounding pharmacies at all. What's
But
happening
they
is
are, though. Come on,
when,
you see it every day. For the same reason you were talking about HIV,
yeah.
they are.
Well, Big Pharma
'Cause
is, and
yeah,
Big
'cause they're
Pharma
taking the
carries such a
money.
big stick. So the reason there's all this bad PR around compounding pharmacies is Big Pharma's creating the PR. They sue. So like right now, Eli Lilly sued my pharmacy, and they make statements that then they release through their PR branch and try and put into the public eye. And I have no way to redact or rebuttal those comments because none of those media outlets are going to interview us to hear our rebuttal. In their rebuttal, their whole comment is basically compounding pharmacies are dangerous. There's no medical guidance or oversight, and they're making these drugs in a garage is how they're trying to make it
Yes,
sound.
that's
What
the
they're not
narrative.
telling the public is these are not, just because a product's not FDA approved does not mean it's not FDA investigated, right? And so the FDA does provide oversight for compounding pharmacies. Every ingredient we buy and source is an FDA approved ingredient. Every ingredient that we buy that is FDA approved is then independently third party verified to prove that it is the dosage and requirement that we say it is. Then after we compound this ingredients and put it all together, we then independently verify it again through a third party. And all of those validation medication tests are kept in a file. And when the FDA comes into our building, we sit down and show them everything. And our head of my compliance and regulatory, because we have over 300 employees. Like last time I was on your podcast, it was 200. Now we already have over 300.
Congratulations.
And people don't understand, like, it's because insurance and big pharma are abusing this system more and more. And compounding pharmacies are the only way a lot of people can afford the medications. It's not a lesser medication. In fact, the beauty is I don't want to dwell on GLP-1s, but here's an example. One of the major issues with the GLP-1, one is the price.
Yes.
Right? They're price gouging the American people, the taxpayers, and the federal government.
Yeah.
And the second is they don't have an ability to titrate up and titrate down because it's a one-size-fits-all approach.
Yes.
And to manufacture that requires a shift in your manufacturing focus. And at Big Pharma's level, you're looking for the biggest dollars as fast as possible, as long as possible. And compounding allows us to make compounds unique and proprietary to the patient. It allows us to sit down with a patient.
Keeping it real with Jillian Michaels.